Let's bring in one of the architects of Obamacare, MIT economics professor Jonathan Gruber. Good to see you, sir. Thanks so much for joining us.
Good to be here, Maria.
So we know what Donald Trump has said on the campaign trail. Can you change the legislation but leave things like pre-existing conditions, young people on their parents' plan? Because those are the two things that Donald Trump said are worth keeping.
There's 2 points, Maria. First of all, on pre-existing conditions, let's be clear, that isn't the big problem that the Affordable Care Act fixed. So let's take the example of my wife. She's a breast cancer survivor. If Donald Trump says insurers can no longer exclude pre-existing conditions, she could walk in and the insurer should say, yes, you have pre-existing condition, I won't exclude it, but I'm going to charge you $10,000 a month, or I'll just deny you insurance. Donald Trump doesn't solve those problems. The Affordable Care Act does.
Okay, but the Affordable Care Act also has made it incredibly expensive for business and for individuals. I mean, there's a reason that United Healthcare said they were going to lose $1 billion on it, and so they're pulling out of the plan. So obviously there's something seriously wrong with this legislation to upset so many people because they can't afford it.
But Maria, I'm afraid you're just wrong on that. Let's start with businesses. 150 million Americans get insurance through their employer. The cost of employer insurance today is $3,100 lower than it would have been that was projected before Obamacare. Individual insurance, which is paid by about 7 million people, is exactly where it would have been absent Obamacare. The press coverage has been completely misleading on this. Obamacare has actually saved people money.
So why have 3 major insurance companies left the exchanges?
They've left the exchanges because this is a new and innovative insurance market for which they're not prepared. They want to offer expensive, broad network products that people don't want. People want less expensive products. They want more selective products, and that's what they're demanding. People are looking for a new kind of insurance. There are other companies that are doing very well that are thriving on these exchanges, and we're in a transition period.
Yeah.
Any new insurance market goes through a transition period.
So why are we seeing, on average, 25% increases in premiums next year, and in a state like Arizona, you're going to see premiums up 116%?
Well, basically, if you look at it, Maria, what you're not accounting for is actually premiums were 20% below where they would have been without the law before these increases. Basically what happened is insurers came in too low. They realized it. Now they're catching up. They're basically where they would have been without the law. You take a state like Arizona and some other states where it's high, that's because these states have fought the law rather than supporting it. If you look at states that have actually encouraged people to sign up and behaved as this law expected, expanding Medicaid and encouraging people to sign up, premiums are very much under control and growing much more slowly.
You know, I've had this debate with Zeke Emanuel many times, and it's very hard to make the case that you're making knowing what the reality is. And the reality is that families cannot afford Obamacare. And the reality is that the premiums for families across the country have skyrocketed. And even if you're in a plan with your company, like you say so many people are, companies are not hiring more workers because they are being forced to provide health care. So the plan 100% is being looked at as way too expensive. That's not press, that's not speculation. This is what families and businesses are saying.
Maria, that's just wrong. I mean, quite frankly, what you're missing is that Obamacare did not fix all the world's problems. You have to ask yourself, did Obamacare make things better in America? Not
Jonathan,
did Obamacare...
what is wrong with what I just said?
What is wrong with what I just said is the following. First of all, you keep bringing in employers. Employer insurance was falling dramatically before Obamacare. Since Obamacare came in, it's been flat. It hasn't fallen, and premiums have gone down. They've gone down.
Premiums are going up in 17, on average by 25%. We know this from the Obama White House.
Not for employers, Maria. You keep mixing it up. Employers, most of your listeners have employer-sponsored insurance. Their premiums are not going up 22%. They're growing at the slowest in measured history.
Because all these insurance companies have pulled out. You've got Humana, United Health, Aetna.
Maria, once again, let's please. They've not pulled out of employer insurance. You're mixing it up. Employer insurance, which is what most of your listeners have, 150 million people, no insurers are leaving, premiums are growing at historically slow rates, premiums are $3,100 below what we expected. Now let's come to the individual exchanges. That affects at most 7 million people.
Right.
Okay? 1/20th is large. There you're right. Insurers have left, premiums are up. In that market, premiums are up to where they would have been before the law, because over the last 3 years they've been down 20%.
Jonathan,
you're not talking about that.
Let's talk about businesses in general, because we have a lot of small businesses on this program. And what they constantly say, day after day, is the reason that they're not hiring more employees is because they can't afford to offer health insurance. And the reason that they don't want to take the number of employees that they have above 50 is because they will be forced to offer insurance. And the reason that they are turning full-time jobs into part-time jobs is so that they can avoid paying for the insurance. So you want to separate business and individuals? Fine, let's do it. Businesses are not hiring workers because the legislation is too expensive. We can disagree on it, but it's a fact. And that's what businesses say when they come on this program. So the question becomes, how do you make this legislation less expensive?
Maria, look, once again, please don't use the word fact, because you're not saying facts. You're saying anecdotes.
I'll tell you what is a fact, Jonathan. I'll tell you what is a fact. A fact is that economic growth is 2% or lower. And the fact is one of the reasons that economic growth is as low as it is because businesses are not hiring workers and not doing activity because of the cost of Obamacare. That's a fact. Do you dispute economic growth? Do you dispute economic growth? 10 years after the financial crisis?
Economic growth is the rapidest it's been in 8 years. Okay? Economic growth, we're coming out of a recession, and Obamacare is irrelevant to economic growth. Please, there is no evidence at all. You are making a totally non-facts-based argument. There is no evidence at all that Obamacare has anything to do with economic growth.
Jonathan, it's very hard to believe you after what you said when this law first came out, that Americans are stupid and that you needed a stupid public to get this law through. In fact, let's roll that by. Listen to this, Jonathan. Here's what you said a few years ago.
Lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to getting the thing to pass.
So we're stupid, and that's why you were able to pass this legislation through.
Maria, I deeply regret those comments, which are you taking out of context.
What's out of context? We just heard you say it. What is out of context about what you said?
What is out of context is that I was at an academic conference conjecturing about something I shouldn't have been conjecturing about. I made a mistake. I shouldn't have said that.
Okay.
That's absolutely true. That doesn't excuse your denying true facts. You're making up facts, Maria.
Okay, so what did I make up? What did I make up?
You made up the fact that Obamacare has caused job loss. There is no evidence. You made up the fact that
there's 100%
there is none. There is Maria,
all I need are 10 CEOs to come on this show and tell me that's the reason, and then it becomes fact.
Who cares if some CEO comes on the show and tells you that's the reason? Look at the data, Maria. You used the word data. Look at the data. There is not a single data point. I don't
need data when I have the CEO telling me I'm not adding workers because of the cost of Obamacare. That is my data. I just spoke to the boss, and he gave me the reason.
Well, Maria, that is absolutely wrong. That's not how you consider data. Data is considered by actually looking at the facts on the ground. And the facts are...
The facts on the ground are the managers of businesses, the people who are actually making hiring decisions, and why they are not putting new jobs in their company because it's too expensive to do so, because of Obamacare. That's data, Jonathan. For you to say that what a CEO says is the reason that he's not hiring people is not important is ridiculous.
Maria, you have people on the show who are expressing a view of one company with potentially, and we don't know what they're going to say. I made a mistaken comment. I regret. Those CEOs are coming on. They're making a comment. Who knows if they're making it for political reasons, why they're making it. The bottom line, Maria, is we have data. They're making it because they can't afford
the legislation.
Maria,
that's why they're making it.
We have data collected unambiguously.
What does your data tell you about making this law less expensive for businesses and individuals?
The law, my data tells you can look at it. If your listeners want to cut through the stuff you're saying, look at the data. Go to the Kaiser Family Foundation. Does an unambiguous survey every year of all employers, and over the last 5 years since Obamacare has passed, the premium growth of employer insurance has been the slowest in measured history. That is a fact. Do not tell me what some CEO says. I don't need to go to the Kaiser Foundation
when I know what my friend is paying for health care, $1,000 and it was $500, or what I know a business is paying, it was here and now it's here. All I need to know is what people are saying. I can't spend this money on activity. I can't spend this money hiring people because I'm spending this money on health care. Do you think that in the first 2 years of President Obama's presidency, when he had both houses of Congress, he should have focused, instead of on health care, on economic growth? Maybe we would be in a different place than we are today at 2% economic growth?
President Obama focused on economic growth, passed the largest stimulus in our nation's history. So don't say he didn't focus on economic growth.
Wait a minute. Did you just say the Affordable Care Act was the largest stimulus in history?
No, I said the stimulus package was the largest stimulus in history.
Right.
Over the opposition of Republican Congress. So don't start blaming President Obama when, first of all, once again, you're moving the debate to economic growth. That's not what this is about. This is about a health care law. And once again, you can yell and bring on CEOs who want to give examples. Your listeners who really want to know the truth.
Yeah,
I urge them to actually look at the facts.
We want to have people who are actually getting affected by the law, not someone in their ivory tower telling us what this should be, but in fact, what people are seeing on the ground, because they're the ones that are being affected by the law. That's why that's fact, talking to CEOs and talking to the managers of businesses, Jonathan. Not somebody who's just looking at a bunch of numbers on the Kaiser website. Good to see you, sir. Thank you. Jonathan Gruber joining us. We'll be right back.